A Charlotte nursing home worker positive for COVID-19 asked to continue to care for residents.
Yeah, we started investigating and found out this actually does not violate any rules. Kind of surprising considering that, stopping the spread of the virus in nursing homes and residential care facilities was a top priority for state leaders. These facilities account for 55% of the deaths in the state, but just 7.8% of all cases. That's an extremely high mortality rate, 13% in these facilities. Compare that to the 1.9% death rate when you look at all the cases in North Carolina. So what are the rules for workers caring for vulnerable residents?
Reporter Mark Becker investigated and looks into how one instance of a sick worker has been handled in Charlotte. Mark.
Yeah, Genevieve, Hunter Woods here in North Charlotte, like other nursing homes across the state, has really been besieged by the coronavirus. Dozens of cases now, including both residents and staff. And we learned that, in fact, under certain circumstances, it is all right for someone who has tested positive to continue to work in a nursing home. And it could well have happened here. The virus hit Hunter Woods hard and fast. In a week, it went from 6 cases to more than 40, including as many as a dozen staffers, leaving this facility scrambling to cover shifts.
He found out last Thursday that he has COVID.
This viewer is a friend of one of those staffers. He told us that even after his friend tested positive, the facility wanted him to come to work.
And his retirement home told him he can come back to work because he's working the COVID wing, and it didn't matter that he had COVID, that he could still help out there.
They told him he could come back to work even though he's positive?
Yes.
In fact, we've learned that to deal with staffing shortages, the CDC guidelines do allow for some workers who've tested positive to continue to work at nursing homes and other long-term care facilities. The State Healthcare Facilities Association couldn't tell us how many other nursing homes in North Carolina have brought COVID-positive workers back to cope with staffing shortages. But in a statement today, a spokesman said the CDC has determined it does not pose a risk to the staff member or the residents they're serving. Are you worried if other employees who are positive are still working there? But another employee at Hunter Woods told us off camera today she's worried that a COVID-positive coworker could infect others. We called Hunter Woods and its corporate office in Florida, but have not heard back from either of them. But the Mecklenburg County Health Department did tell us today that they don't believe there's a critical staffing shortage here yet, and so no workers who are COVID positive should be on the job. And that employee who was asked to come back to work after that positive test, well, we're told he is at home, he is very sick, and that the county health department has told him they'll have to clear him before he can come back to work here or at any other facility. John?
Wow, really a surprising report there. Mark Becker live for us tonight.